Welcome, everyone. Thanks so much for joining our Facebook Live event. I'm super excited to be talking about weight management, about diet, exercise, medications, and so much more. My name is Dr. Eva DeCoco. I'm a board-certified family medicine physician practicing at Kaiser Permanente in Baltimore, Maryland. I'm joined today by my incredible colleagues, Dr. Youssef and Dr. Isanu Iwu. We are so excited to be talking to you today about weight management. Discovering the right weight management strategy for your body is essential. With the prevalence of fad diets and weight loss meds, it's important to find a safe and effective approach tailored to your unique needs. Today, we will share what you need to know, including small changes you can make in your everyday life that will help you achieve a healthy weight you can maintain and sustain. Let's get started by having our panelists introduce themselves. Dr. Youssef, would you like to start?
Sure. Good morning, everybody. I'm Dr. Christy Youssef. I practice over at Kaiser Permanente in Fair Oaks, Virginia, and I'm a board certified family physician. I'm super thrilled to be here today. Can't wait to have a really great discussion today.
Thank you so much. We're super excited to have you. And Dr. Isan Iwu?
Hello, everyone. I'm Dr. Esonu Iwo. I'm board certified in family medicine as well as obesity medicine, and I practice at Kaiser Permanente in Baltimore, Maryland, and I'm happy to be here.
Thank you so much. We're super excited to have both of you on board, especially with all your expertise, both as primary care physicians as well as helping patients lose weight. We're looking forward as well to everyone out there for your questions. So if you're watching live, please post them in the comments on Facebook. As we wait for those, let's go ahead and dive in. So a great place to start is just the basics. So for instance, a lot of patients want to know, how do doctors determine what a healthy weight is? Dr. Youssef, this may be a good question for you.
Oh, sure, absolutely. So there's so many things that we take into consideration when we think of a healthy weight. I mean, there's a variety of different methods, but one of the most used tools is the body mass index or BMI, which is used to measure a person's weight in relation to their height. So while BMI is a useful screening tool, it has its limitations and it doesn't really consider factors such as muscle mass and bone density or body composition, which is just among which varies, of course, among different individuals. So while we use the BMI, we also consider things like waist circumference, where we measure the circumference to help us determine the abdominal fat, because when you measure waist circumference, um, the the thought process is that higher waist circumference leads to a higher risk for certain health conditions like heart disease and type 2 diabetes. Um, and also one thing that we use is body composition tests. At some clinics will have you do methods like bone density scan and some kind of bioelectrical impedance testing or skin fold thickness testing as a way to measure your body composition. But the most important thing to focus on is that there's not one healthy weight per person, and it can vary from person to person based on your overall health. So that's a great conversation you can have with your primary care physician. And certainly talk about things like cultural and societal factors that affect you as well.
No, that's great that you bring that up. So does the definition of being overweight or obese, does that perhaps change depending on someone's background?
Absolutely, and it also changes based on someone's um, sex. So, of course, the male, for example, the male waist circumference measures slightly different than the female waist circumference and can be labeled higher or lower based on gender. And also, cultural and societal factors can influence perceptions of healthy weight too. So we as physicians are very sensitive to these factors, and we definitely engage patients in like patient-centered discussions about weight and health, and that kind of thing to make sure that we understand you as a whole.
No, I think that's so wonderful that it's so individualized and not necessarily one size fits all.
Yeah.
So if patients go in to their doctors and they may notice that the word overweight or obese is on their chart, what does that really mean?
So, yes, overweight and obese sort of lets us know that these patients are at higher risks for other chronic health conditions. It helps us to guide our treatment for screening, screening for things like diabetes and hypertension and elevated cholesterol. Based on the BMI, there are different, categories based on what your BMI. So if you hear the term um, overweight, we're looking at a BMI where between 25 and 29.9, for example, because a normal BMI is considered anywhere between 18 to around 24.9. And then going forward, anything above a 29.9 BMI is considered obese. And so we kind of counsel based on where you fall in the line of BMI criteria.
And that's great to know. So it really kind of helps your doctor know as to what you may be at risk for and what to screen for. So
Mhm,
that's great information, I think.
mhm.
Certainly, thank you.
You're welcome.
Now, for Dr. Isanivu, how would you say that weight loss or weight gain can impact a patient's quality of life or even other medical conditions that they may be at risk for?
Thank you, Dr. DeCoco. Um, we know that excess weight is linked to a number of health complications. And so ranging from cardiovascular disease like high blood pressure, diabetes, heart disease, strokes, all the way to arthritis. So excess weight puts more pressure on the weight-bearing joints and it predisposes to osteoarthritis. There's a connection to various kind of cancers, other health conditions like sleep apnea, infertility, fatty liver disease, which can lead to cirrhosis. So there is a link to a number of medical problems. It's also linked to mental health issues like depression and even just body image issues and how that affects one's ability to be all they can be in their career, in school, or in their social circles, or your ability to be active and keep up with activity and not be short of breath. So there's a wide-ranging list of complications from excess weight. The good thing is weight loss, we know, mitigates all of these complications that I just mentioned. And you don't need a lot. The evidence shows that 5 to 10% will produce improvements in a lot of these things that I've mentioned. So if you weigh, say, 300 pounds, for example, when we use the BMI, 18 to 24.9 is a healthy BMI, but you don't need to get down there to notice improvement in diabetes or in the arthritis or in all of these things. A 30-pound weight loss, which is about 10%, will show improvement. So that's really encouraging. It's good news to know that small changes and incremental weight loss does produce improvements in these health complications.
That's so good to hear because I know it can be very overwhelming
Oh,
to
yeah.
because I know when my patients ask me, okay, well, what normal weight should I be? It can be
Yes.
very overwhelming if you're asking someone to lose this amount of weight. So it's wonderful to hear that even a small 5% can improve that long list of complications that you brought
Yes.
up.
Yeah.
So I know that that can be very reassuring for those of us that are certainly struggling to socially distance ourselves from our refrigerators. And a question for you again. What are some common causes of weight gain?
I get this all the time from patients, why? Why? Or I'm doing X, Y, and Z, and it's not working. There's not one cause per se. It's multiple things that come together to affect weight. So just like our genes determine how tall we're going to be, our genes also determine what weight we're going to be dealing with over the course of our lives. And so we start there and we move to our environment. From the environment in utero when you were in the womb. Did your mom smoke? How much did she weigh? What was her blood sugar while she was pregnant with you? All of those things have a role to play. We're born into families and into communities. What's the culture of our family and our community around food, around exercise? And then we live as well in communities? Is there healthy food around us? Do we have safe places to exercise? Some health conditions affect weight. One that comes to mind is hypothyroidism. Some medications we use also affect weight. For example, somebody who has to be on steroids for a long time. So it's multiple things. It's not really one thing. And for everyone who's struggling with their weight, it's probably two or more of these factors coming together to affect weight. So um, yeah. And it's a good thing that the changes we also have to make are multiple things coming together also to affect weight in the opposite direction.
Yeah, absolutely. It sounds like there's not really any one simple reason that we so easily put on the weight and it's so tough to
Yes.
take it off. But some of them may not be within our control, but thankfully, some of the things there that we can do, like lifestyle changes that a patient can make, can help them maintain a healthy weight. Can you talk a little bit about some diet and lifestyle changes that may be beneficial that we can control?
Yeah. So, bird's eye view here in our program across the region, we refer to these as the pillars of lifestyle changes. And so we deal with changes to diet, water intake, our physical activity, sleep, mood. We're working with our patients on all of these areas to impact weight. So it's multiple things coming together to impact weight in a positive direction.
Oh, that's very interesting. So it's not just necessarily about diet and exercise, right? So can you
No.
talk to a little bit more about some of these other pillars, like the impact of sleep and water and mood?
So I can start just with the diet changes because that's a big area and
Hmm.
tends to be sort of the foundation. And as we've said again and again, as we've been talking, and we'll probably say again and again, there's no one size fits all, right? And so the best diet for you is one that you can stick with and one that is giving you the nutrition that you need. Some things are universal, like we want to cut out processed food. We want to cut back on red meat and move more towards whole foods and move more towards a plant-based diet as much as we can. Um, but other things are really just what you're going to stick with. And when they study the diets head to head, they produce similar amounts of weight loss. But if you're not going to stick with it, if you do something that's just so out of what you're comfortable with and you just do it for 6 months and then you don't stick with it, you gain all the weight back and then you just cycle weight. So Mediterranean diet has been found to be successful mainly because you make small changes that a lot of people are more likely to stick with, as opposed to, say, something like the ketogenic diet. A lot of my patients personally haven't been able to stick with it just because it's such a big change. Now, there may be some people that would work for, but I haven't found that patients have been able to stick with it. So it's, will you stick with it? And is it a healthy diet with giving you all the nutrients you need and in a sustainable way?
Yeah, I think with any of my patients, I'm always saying, don't, if anything has the word diet in it, it's probably not going to be sustainable
Yeah.
because everyone just thinks they need to be on it for a few months, lose the weight,
Yes.
and then they can go back to eating all the pasta they want. But
Mhm.
really, it's making that sustainable lifestyle change that's really
Mhm.
key. So I love your focus on the plant-based whole food diet that is a lot more sustainable than just making short diet changes. I love that.
Yeah.
And you had mentioned some other areas too that patients can work on. Dr. Youssef, do you have any comments on physical activity and mood and sleep that patients can also
Sure.
focus on to help with their weight loss?
Yes, and I do believe that the term sustainability will be our key term today. We're
Yes.
doing
Oh yeah.
everything we're doing to be sustainable in the long run. But yes, absolutely. There's so many different things that go into maintaining a healthy weight. Of course, everybody hears about exercise. And when I talk to my patients about losing weight, the first thing they say is, I'm going to go to the gym 7 days a week. Actually, what you'd be interested in hearing is that your aim is for about 150 minutes of moderate intensity exercise a week. Okay, so that's what's recommended by the CDC, or 75 minutes of vigorous intensity exercise per week. So it's really about the options you choose. Aerobic activities like walking and jogging
Hmm.
and swimming and cycling, those are the kinds of things you should try to do. If you've never exercised before, start slow and go up. Give yourself small little goals to achieve as you go along, because if you set out to go to the gym an hour every day, but you're not used to going to the gym, you can have other issues that prevent you from making this a sustainable habit. Start 15 minutes every day, work up to 30 minutes every day, and then go forward. Choose activities that you enjoy. Make sure you include some strength training exercises to build muscle. And that can also boost your metabolism, which will help with weight management as well. Choose activities that pertain to flexibility and balance. So this is where you would include exercises like yoga and Tai Chi, and it just helps to overall balance you out with your exercise. So you're looking at aerobic exercise, strength training, flexibility and balance treatment, training. It's just important to say you need daily movement.
Yep.
Find ways to increase your physical activity one way or the other. Take the stairs, walk or bike instead of driving, park very, very far away from the mall door. Do physical activity, go to house chores, be on your feet as much as possible. That increase in daily movement is also going to contribute to your overall everyday exercise, which will help with promoting overall well-being.
And I
Another
know
thing that,
for oh,
oh,
sorry.
no, go for it.
No, I was just going to say, no, for those of us with very busy schedules, it can even be hard to find just the time to go to the gym. So I
Oh, yeah.
know for me, sometimes it's even about making little decisions. If I'm at the park with my kids, instead of sitting on my phone on the bench, I'm trying to stand up more often and run around after them if I can.
Yes.
So even making those small changes can be helpful.
And even breaking it up in the middle of the day. So let's say you can't dedicate an hour to exercise or 40, 50 minutes in exercise. Do short 20-minute exercise on your break at lunch, right before
Yeah.
work. Walk for 20 minutes, then go. And you can do it as cumulative exercise as well throughout your day. It's very helpful.
Yeah, and if walking is all you can do, that's great. But you also want to make sure you mention the importance of moderate, like kind of
Mhm.
paced exercise or even vigorous. So you want to try and be doing something that's at least getting you a little bit more up and active and your heart rate going. So
Sure.
definitely,
If you
I know.
can tell everybody about your Friday night hangout while you're walking, you're not walking fast enough, and
Yeah.
you got to get that heart rate up, right? They
Such
say
such a
that.
Good.
great tip. Yep.
Yeah.
So if you can't sing while doing it, then you're not
Absolutely.
doing it. Yeah, absolutely. And I think you were about to tell us about other behavioral changes that can be helpful too.
Oh,
Sorry to have
sure.
interrupted.
It's okay. No, I always put a plug for getting adequate sleep. It's one of the pillars that we talked about, that Dr. E talked about earlier. You need to aim for about 7 to 9 hours of good quality sleep a night. Poor
Yeah.
sleep can disrupt your hunger hormones. That can lead to weight gain.
Yeah.
So go to bed and wake up at the same time every day, even on the weekends. This will help guarantee that your body's internal clock is listening to your hunger hormones. You also should create a relaxing bedtime routine to signal your body that it's time to wind down, because that can definitely help shut the mind down and get you geared towards healthy, restful sleep. Now, um, this is also an important message that as we are treating patients who are trying to get healthy, one thing that we ask is, do you snore? Do you snore loudly? Do you stop breathing when you sleep? Because if all of those things are going on, you need to let your doctor know, and you need to be screened for sleep apnea, because sleep apnea can also cause you to have persistent weight gain,
Mhm.
elevated blood pressure,
Mm,
increases your risk for heart attack and stroke. And so we definitely need to address that issue as we address getting you healthy for sustainable weight loss.
absolutely. And you may not even know it. So it's that one's important to screen for with the sleep apnea.
Yep.
Yeah.
And Eva, or Dr. DeCoco, one of the things that I do is I talk to patients about managing their stress levels.
Oh
So
yeah.
practicing stress reduction techniques like deep breathing and meditation, mindfulness and yoga, those are the kinds of things that will help reduce your stress levels and also help prevent overeating and help you to overall just feel more balanced with your weight and your healthy lifestyle.
And do you find if patients are trying to do all the right things with making changes in the food that they're eating and their physical activity and their sleep, but perhaps we're not addressing their mood, then they may still struggle then to
Mhm.
lose weight or maintain a healthy weight?
Yeah.
Absolutely. And I just did an article talking about the effects of elevated cortisol, which comes with stress and anxiousness and mood problems, with how it pertains to keeping your weight up. And so that's something that you should definitely take into consideration and to seek help, but also seeking social support from friends to help you live a healthy lifestyle is going to be important too.
Yeah, so it sounds like all of these are important. So we don't want to lose sight of any of them
Mhm.
when working on our sort of our own personal weight loss journey. I think
Yeah.
you had also mentioned, Dr. Isaniwu, the importance of water, which I know can be maybe surprising to some out there.
Yeah. And so, well, we need water for life. And most of us are chronically mildly dehydrated. Like we're not getting enough water, which affects our metabolism overall. And sometimes when you're thirsty, our brains can mistake it for hunger. And so sometimes we snack instead of drinking water. So focusing on getting enough water. And for my patients, I typically say at least 64 ounces daily, as long as they don't have heart problems or some other reason why they shouldn't be drinking a lot of water. Aiming for 64 ounces daily, it keeps you full. It helps you with all of that mindless snacking, and it's just good for your health overall. And some medications, um, do need you to be drinking more water so you don't go get a kidney stone or something like that. So yeah, water is critical in all
I
of
know
this.
something so simple, and
Yeah,
I oftentimes though have to remind that water and other fluids may not be the same, right? So if
no,
you're
no,
so it's easy to get tempted to, drink a lot of sweet tea or carbonated beverages. It may not have the same benefits and may even be harmful, obviously, with the processed sugars and many of the
correct.
soft drinks out there.
Mhm.
I tell patients that you still have to eat. So you don't want to drink your calories. You want to drink water because you still have to eat food. So save those calories for your food.
Yep. Yes.
Absolutely.
Yeah.
Mhm.
Now,
Yeah.
switching gears a little bit. I know one of the hot topics right now out there is about prescription weight loss medications, and I know it's a big open-ended question here. But what are some of the more common medication options for weight loss, and how do they work?
I guess I could take this, Dr. DeCoco. There are pharmacological options for weight loss that are typically considered when these lifestyle changes that we just talked about, like diet and exercise, haven't been effective. Um, and when obesity poses like significant health risks, we tend to kind of discuss with patients, okay, maybe this is the time to utilize medications for your for some assistance. Now, these medications are intended to complement the healthy diet and exercise regimen. And medications for weight loss, they span many different um, mechanisms of action, for example. But in general, they target weight loss by working either to suppress the appetite and reduce the hunger, or to reduce food cravings and reduce the rewarding effects of food. Um, these medications, and I mean, you can throw out many different types. There's the most common that you'll hear about, phentermine and quizimia and Contrave, just to name a few. Ally. These medications can help people lose modest amounts of weight when they're combined with diet and exercise. And really, a comprehensive weight loss management program is very useful in these cases because it'll address all the aspects needed for sustainable weight loss. Um, it is important to emphasize that weight loss medications are not a standalone solution for obesity, and they should be monitored by a physician because of some of the side effects that you can get. Um, and should be heavily regulated, and the choice of medication and the decision to use them is based solely on an individual health need and risks. And you might have some health concerns that prevent you from taking some medications but would help you with others, and so that's why it's good to have a conversation with your doctor.
Absolutely. So it sounds like it's as usual a very complex answer.
Very.
Um, Dr. Isaniva, when would a doctor recommend weight loss medications to a patient? Because it's not necessarily for everyone.
It's not. So I'll start out with what the, for most medications, they're approved if your BMI, what Dr. Yusuf described earlier, is 30 or greater, or 27 or greater, along with one of the complications of excess weight that I had mentioned earlier. So that's the where we start from. Now we deal with the individual patient. So what have you tried before? You know, how much weight do you need to lose? What complications are we dealing with at this time? And so with my patients, I review, if they're interested in medications, I review the medications, how they work, what the side effects are, what other health conditions they have and how the medications affect those other health conditions, how the medications interact with some of the medications they're taking. Not everything can go together with other medications you're taking. And we sort of come to a decision. Lifestyle changes are the foundation. We can't do without the lifestyle changes. And after discussions, sometimes we decide, let's try these lifestyle changes first, see how you do, and see if these side effects of the medication are worth it. Do you know that the benefits outweigh the risks for you? There's some of the patients who will come in and they're really frustrated. Maybe they've worked at this and, lost weight and regained the weight and lost weight and regained the weight, or nothing just seems to be moving and they don't feel like at this time, I just want to do these lifestyle changes. That might be a patient where we're resuming the lifestyle changes along with the medications at the same time. So it really, really varies. This is one of those things where it's very individualized. You need to talk with your doctor. The same thing that worked for your sister or your girlfriend is not going to work for you. It's very individualized, based on your health, your medications, and a lot of factors that we take into consideration.
Absolutely. And I know
Yeah.
there's been a lot of questions out there in the media about some of these trendy new weight loss medications, such as Wegovy, Saxenda, Ozempic. Can you tell us a little bit about that? Are they safe, effective?
So they're effective, otherwise they wouldn't have gotten approved. Um, and they're safe for the right patient. It's always going to be a individualized decision, right? So side effects that they can produce, such as pancreatitis, so they delay the gastric emptying, and some people get gastroparesis. Gastroparesis is like a weakness of the stomach wall so that it's not emptying as well.
Mhm.
Kidney injury and the risk of the medullary thyroid cancer. So we consider a lot of these things when we're thinking about prescribing medication. For the right patient, they may be the right medication, but it's really something that you have to discuss with your physician. I will say Victoza is one medication that's in this class, the GLP-1 medications. It was approved in 2010, so they're not brand new. Victoza has been around, but more people are taking these medications as we have more of them released. And so we're seeing more of the effect with weight loss, with diabetes, with improvement of cardiovascular outcomes. And we're also seeing more of the adverse events. And so, like you've heard over and over again, sustainability and individualize is what's the theme running through this discussion today. You do have to have a conversation. I've had patients who took Wegovy and lost no weight. So it's not even going to work for every single person. You really have to discuss for yourself with your doctor what's going to work for you.
Absolutely. And I
Mhm.
know, while some of these medicines have been around for a while, they've predominantly been used for treatment of diabetes. So I think there's
Correct.
still a lot we're learning about the use of these medicines for the treatment of just for weight alone and the impacts that may have, both the positive as well as potential negative. You had mentioned the slowing of the gastric or stomach emptying. I know that can, have unintended consequences, right? If somebody needs surgery, so there's, I think, a lot we're still learning and will be learning as these medicines start being used more frequently.
Yeah. Yeah.
Absolutely. Great points, because I know it's been something that everyone's been asking about. Now, what about what's been your experience? And this question is to either of you, for patients when they stop these any of these medicines.
Yeah,
I've noticed a lot of times stopping the medication without changing diet and exercise can lead to a degree of weight gain, depending on which medication you're taking, how often, how long. So if you haven't done your due diligence of changing the way that you eat and adding exercise, there is going to be a considerable amount of weight gain after stopping the medication.
yeah.
And
We
and
have,
that's go
go
ahead.
on. We have our bodies tend to want to be at a certain weight. And so when we lose weight from that weight, we have to maintain those lifestyle changes to keep the weight down. And so this is why, like Dr. DeCoco mentioned earlier, a diet, anything that's a short-term thing, you go down and you come back up. It's the same thing with the medications. And so, yes, we plan to use them long term, but we're using them with lifestyle changes, and we can sustain weight loss with the lifestyle changes. Otherwise, yeah, you do have to plan to be on these medicines for a long time, which is part of the consideration with starting them, because the adverse reactions, the cost of the medications, and all of these things, you do have to, when you're thinking in that moment when you're so worried about the weight and I just want to get these 20 pounds off or whatever, you do have to think about it, that it's not going to be something, there are no changes that you can do short term. You do have to plan for long-term changes. So nothing beats the lifestyle changes again.
No
Like,
shortcuts, no
no, yeah,
shortcuts. I
yeah.
wish, I wish, I know, right?
Yeah.
But yeah, I think that really emphasizes that importance of those lifestyle changes and really focusing on those pillars of
Yeah,
the foods that we're eating, the exercise, the sleep, the mood, the
Yeah.
water intake. All of that is so key, whether you're on medicines or not, because it sounds like even with these medications, if you're not on them long term, you may gain the weight back after
yeah,
stopping.
yeah,
So it's definitely important to focus on all of those things that we talked about earlier today.
exactly.
Now, Dr. Youssef, I know sometimes you see patients that really have just tried everything. They've really worked on the lifestyle changes. They may or may not have even tried medications. What happens? How do you help those patients when they really have tried everything out there?
Oh, yes. I mean, that's a conversation that we need to have. We go through everything that you've tried, how much success you've had with previous attempts, and then we have a face-to-face discussion on whether bariatric surgery might be an option for you. It's a tool that we have in our toolbox to help patients with weight loss for long-term sustainability when their obesity and their diabetes or whatever side effects of their obesity can have long-lasting effects. The decision to have bariatric surgery over other weight loss methods is a pretty complex decision that needs to be made, and it has to be looked at carefully. Multiple consultations are given, but you ask yourself who sort of qualifies for bariatric surgery first and foremost. And I would say um, the we look at patients who have a BMI of 35 or greater with the significant obesity, or people who have BMIs of um, 35 with an obesity related condition like heart disease or diabetes, um, uh, heart trouble, sleep apnea. By the way, I said it was a BMI of 30 to 35 with those significant side effects. So those are the kinds of black and white parameters that we look at, but we also have to look at your long-term commitment to this, because bariatric surgery is not a quick fix. It requires lifelong commitment to changing your lifestyle. Patients must be ready to adopt a strict post-operative diet and engage in regular exercise and attend follow-up appointments. And so this is not a quick fix, and it's not for every patient. And that's why when you are considering bariatric surgery, we go through a very rigorous process of making sure that everyone who goes through the process is prepared for the long-term commitment. There are some risks and benefits to bariatric surgery that you'll probably have a long conversation with your specialist about. And so weighing all of your options is important at this particular time.
No, I think that's such a great point that even with surgery, if you don't make the lifestyle changes,
Mm-hmm.
the weight can come back, and
Yeah.
then not only do you have the weight back, but you may also have sort of all the potential down the line side effects
Yeah.
that are common with the surgery. So certainly not to be taken lightly, but it's good to know that there are at least options available.
Yeah.
Mhm.
Now, we have a question coming in from Facebook Live, which I think is such a wonderful question. It's a great one. It's asking about, is the reversal of diabetes possible? So if someone works on all of these lifestyle changes that you're talking about, can they reverse their diabetes?
Yeah. So I'll take that one. Um, yes and no. And so the yes is you working on all of these lifestyle changes that we've mentioned, you can get your A1C and glucose controlled with the lifestyle changes so that you no longer need medication for diabetes. However, we would still consider that patient diabetic just because there are other things that we do with diabetes. So for example, the eye screening for retinal disease and doing the foot exam and certain lab work that we need to keep an eye on, we still have to be doing all of those things because just like we mentioned with excess weight, where it's very easy for the weight to creep back up. With the diabetes, even when you control it, any of those lifestyle changes that you let go of, it's very easy for your sugars to come back up again. And so we're still keeping that monitoring going, but yes, it is possible to reverse it in the sense that you can come off medication for diabetes and maintain healthy blood sugar levels just with your diet, your exercise and sleep and all of that. So
And considerable weight loss can help improve obstructive sleep apnea,
yeah,
can lower your blood pressure, can reduce your cholesterol, and all of the side effects that come from those side effects. So that's important to note. Yeah.
No, I think that that's
absolutely.
exactly the conversation I have with my patients as well, as sort of the diagnosis sticks with you and is a helpful reminder so we can make sure we're doing the appropriate screening practices.
Yeah.
But the good news is it's incredibly well controlled and your A1C is good and you don't need any medications. But if anyone asks, you do technically have the diagnosis.
Mhm.
That's a really good question. I get that one a lot as well.
Mm-hmm.
So I know one of the other questions that comes up as well is what resources are there out there for weight management? And I know there's a lot, so I can at least speak to some at KP. So one of the things that has been incredibly helpful is our diabetes prevention program, and this is actually available outside of Kaiser as well. So we'll post the link to the CDC website. And DPP is a year-long program that was developed specifically to help prevent type 2 diabetes. It's taught by a trained lifestyle coach who leads the program, and the curriculum is actually evidence-based. It's put out by the CDC. It's a group-based class setting where you're focusing on those sort of 5 pillars that we've been talking about long-term sustainable lifestyle diet changes, increasing in physical activity, that same 150 minutes per week mentioned, as well as the importance of behavior changes and sleep and mood to help with weight control. So it's a class that goes on for a year that you attend with the same people working on a goal of about 5 to 7% weight loss. And so the research has actually shown that if you actively participate in a DPP-like program, it can actually cut your risk of developing type 2 diabetes by 58%, which is tremendous. And once again, this is without any medications, without anything else, but just these lifestyle changes that we were focusing on. So it's a fantastic program available if you have pre-diabetes or are at risk. So I definitely encourage anyone to check that out, see if you qualify, meet the inclusion criteria, and it's available to our KP members, but can also be found in other programs as well. So just check out the link that we'll post. Here at Permanente, we also have many other resources. We have several KP member benefits. and to help patients lose weight. We have health resource coordinators that can work one-on-one with patients, as well as nutritionist appointments. We have classes available on weight, cholesterol, prediabetes, exercise classes, most of them virtual as well, so it makes it super convenient, and it helps you then connect to other programs. I think one thing that's also important in these conversations is not everyone may be ready for sort of a long-term longitudinal lifestyle change program, and that's okay. We want to meet you where you're at. So if you're ready for these big changes, I think the long-term longitudinal programs are fantastic. But we also have these one-on-ones and these classes that are available as well if you just need some information and don't know where to quite get started.
Mhm.
But yes, so we have lots of awesome programs, as well as our amazing lifestyle medicine physicians, two of whom are here with you today. So they also run a physician-led program to help with weight loss for our high-risk members. So definitely lots of good resources out there, both at KP, and if you're not with Kaiser, there's many resources out there that you can connect with your primary care doctor on, and they can help guide you on your weight loss journey, because you're not alone, and we know it's not easy for any of us, speaking personally for myself as well. So we're here to help you, and we want to help you because it makes such an amazing impact on your health and all the wonderful benefits. So if there's any questions, feel free to post on Facebook. But Dr. Youssef, do you want to give any closing thoughts on your end?
Sure, absolutely. I want to thank you guys for taking the time to meet with us today, but also I just wanted to focus on it should be about your overall health and well-being rather than just a number on the scale. And whatever you do, get with a provider, a physician who will do more of a holistic approach in assessing and managing your weight and really counseling you on all the aspects of changing your lifestyle. And going forward, if you have any questions, feel free to reach out to me.
Thank you so much. Dr. Isan Iwu, any closing thoughts for the team?
Yeah, thank you. Thank you all first for such a great conversation, and thank you to all of you who joined us for this session. I will close by saying sustainable changes are important, and those changes have to work for you. They may work, something else may have worked for your friend, but the changes you make have to work for you. So start small and build, and then discuss with your physician who is able to get you the help you need so that we're supporting you medically to be successful with the changes that you're making with your lifestyle. But lifestyle changes form the foundation of any weight loss intervention. So we can't do without making those changes to our lifestyle.
Absolutely.
Those couldn't have said it better myself. So absolutely, like you said, sustainability, lifestyle changes, the key to all of this, focusing on those 5 pillars of diet, exercise, sleep, mood, water intake are so important. I'm so grateful to have gotten to spend time with you guys today and learning from your expertise. It's been amazing. Thank you so much to everyone out there on Facebook. We really appreciate you joining. Hopefully you've learned at least a little bit. If not, let us know. We're happy to answer questions at any time. Thank you for tuning in to this Facebook Live event. For health information like this, visit kp.org/doctor. And from all of us at Kaiser Permanente, be well.
Thank you.
Thank
Have a good
you.
day.